Hello, everyone. Thank you for joining us today. We're presenting on how setting up a child fatality review program had initiated interest in a trauma-informed organization. We are hoping today that we can tell a story about how we got to the place of writing a policy that shows organizational support and helps break down the stigma around mental health support. Um, I'm Rebecca Moon. I work as a health promotion specialist too at the Kittitas County Public Health Department. That's in Ellensburg, Washington. I received a Bachelor's of Science in Public Health, Population Health Specialization, as well as a Master of Public Health, both from Central Washington University. I have about 9 years experience in public health related work. I am a mother of an 11-year-old son and also have my 16-year-old nephew living with me.
Hi, I'm Cameron Walker. I also work at the Kittitas County Public Health Department in Ellensburg, Washington. My education background is in organizational leadership and development with a master's degree in administrative management. And I started working public health about 4 years ago during the pandemic. And like Rebecca, I'm also a mom. I have a 4-year-old son. So, what is child fatality review? The intent of child fatality review is prevention. Child fatality review may also be known as child mortality review or child death review. And in these reviews, a multidisciplinary team reviews individual child deaths and then they form prevention recommendations. So the core team may include emergency medical services, a medical examiner, a coroner, a pediatrician, law enforcement, prosecutor, and child protective services. And then, depending on the case being reviewed, there may be other partners included, like there may be someone from the school district or a mental health professional that is involved. And public health's ability to do child fatality review is protected by Revised Code of Washington, or RCW. And in Washington state, ours was recently updated. The new version goes into effect at the end of July of 2025. And the most notable changes are that it expands from being able to review under the age of 18 to under the age of 19, so a year older. And then it also requires that agencies provide all reports to the local health department. Before this update, providing the reports was at the discretion of the agencies, and now with this update, it will be a requirement. So for those not like in the room, not working on child fatality review, the process is that as facilitators of the CFR team, we select each case, review case records. This could include autopsy reports, police reports, medical records, or scene photos. And then we facilitate the team meeting, compile the recommendations and data entry, and then create reports. This process is repeated with each case. So as a facilitator, you repeatedly review potentially traumatic events. And the last time our organization did this work was in 2011. And at that time, the work ended due to a lack of funding.
Our health promotion team that Cameron and I work on, we're exploring the most effective ways to use our foundational public health services funding. We had started with several really broad ideas, and pretty quickly we started hearing that a few other counties around Washington state we're using the funding to restart the child fatality review work. We began kind of investigating the history of the work in Kittitas County, and then around our state, some of the legislation and those types of things. We found out that in the past, the CFR work had been state funded from about 1997 through 2003. And after that, local health jurisdictions, they had to seek out alternative fundings within their own county. Kittitas County, as Cameron had mentioned, was continued until about 2011. We had ultimately decided that starting child fatality review work again here in Kittitas County would be the best use of our time and money for our team. What we did was we started with a logic model and kind of a brief outline of what the program would look like. And if you're not familiar with the logic model, it is somewhat of a timeline of the resources that it's going to take, short-term, middle, and long-term outcomes. One of the initial topics that was brought up with all of the things that it would take and what that means in setting up the program was staff wellness. Our idea at the time were regarding resources that we currently had available to us, things such as our employee assistance program. However, pretty quickly questions came up about secondary trauma supports. Almost pretty immediately as well, we connected with Washington State Department of Health and several other counties who are participating in CFR work. Some counties were just starting out, some were restarting work similar to us, and a handful of the larger counties, like Snohomish County or King County, had been doing CFR work continuously throughout. They had found funding to continue doing it. We definitely found it really helpful to connect with the counties who had experience over the years, and it was also really helpful getting connected with the National Center for Child Fatality Review and Prevention. We, at that point, had received a great deal of resources that were really supportive in developing our program locally. And again, we started asking more questions about resources, plans, or perhaps policies for supporting the mental health of the team. And it was pretty limited. We didn't have very many resources. When we first started gathering that information, the only term that we knew, as I mentioned, was secondary traumatic stress. However, we received a vicarious trauma presentation from a superior court clerk in another county, and this really helped us expand the search because now we had a new term and vocabulary. Um, from here, while we were researching vicarious trauma, several more terms started to emerge, which really helped us develop language to talk about the topic and kind of expand the research. On the slide here, you can see a sample of the article that explains vicarious trauma's impact on a person. It states that it can change their cognitive pattern. This means that it can change the way that they see themselves and the world around them. This article was published in 2021, which was really only 4 years ago. The research that this research compiled years worth of information, and what they found was what they're talking about are tips for self-care, therapy options, alternative medicine programs, and a variety of other a variety of other ideas. But what I want to know is the suggestions of organizational supports, work culture, and access to resources. Like some of this is personal responsibility, and also some of this is organizational responsibility. This really got us thinking about the long-term effects of starting potentially traumatic work. As, like I said in the logic model, we're really looking at the outcome. We want to begin with the end in mind. Um, we started to think about things like what would happen when the current team gets burnt out or triggered or can no longer do this job. What happens when a new team member comes in and doesn't have the experience working with potentially triggering information. Um, these folks will continue to come along and come and go, and the trauma cycle repeats if we don't have those supports in place. So this Headington Institute is a group of psychologists and researchers whose stated vision is to seek to be the most innovative and trusted partner for organizations with staff working in high-stress environments across the globe, and to help them both maintain their well-being and thrive in their work. This was a reading course. We learned more about the details of vicarious trauma, things such as risk factors, signs and symptoms, what can organizations and managers do, and some ideas on how to make a vicarious action plan. This really helped us confirm the findings that we were coming across till this point, kind of reiterated some of those and really solidified those thoughts. It was about this time we were invited to sit in on a review team meeting for another county, and it really, we really started to grasp the amount of time before meetings, during, and after the meeting that we will be spending with this potentially traumatic information. As you saw several slides ago, Cameron did kind of an outline of how that looks from the very beginning of selecting the cases and deciding which reviews you even want to start with. Um, After that meeting, we debriefed together here right away, but it really wasn't until several days later in the evening on a Tuesday. I remember I was headed to pick up my son from one of his friend's house from a play date. I seen a common object that was referenced and shown in that review meeting. And then I realized like powerful impact that it was going to have on me and the way that I view the world.
Yeah, I I agree with Rebecca. I had a similar experience after shadowing that first review team meeting, and I would say I experienced like symptoms of vicarious trauma. It was several months after that first review team meeting that we shadowed, and I, you know, my son was helping his grandpa push a lawnmower, and my son is 4 years old. He was doing it very safely with help, and I still couldn't watch because I was so stressed about like the potential danger in that situation. And that's what really hit me, that like this work can have such a profound impact um, on yourself and the way you see the world. So with more language and background and suggestions for organizational support, we started researching what workplaces were actually doing. So what's listed on the slide here is not an exhaustive list. It's just kind of the initial resources that we came across. So the National Center for Fatality Review and Prevention has guidance for addressing vicarious trauma, and this is related specifically to child fatality or child mortality review teams. And then the Tacoma Fire Department has actually an Emmy-nominated documentary that highlights post-traumatic stress disorder, specifically in the fire service. And what was interesting about this is that they have their own staff mental health professional
Mhm.
at the Tacoma Fire Department, and this professional is a field traumatologist. So she's trained in helping people respond and recover from the trauma, specifically in disasters or critical events. Um, I I really recommend watching it. It's a good kind of introduction into this work. And then we also found that the Washington State Department of Enterprise Systems has some really helpful information um, for their employees about the Employee Assistance Program, or EAP. And some of this information includes improving well-being and knowing what to do during a crisis. And they also have resources and tools specifically for supervisors who may have team members or may themselves be experiencing that situation.
So the support from an organizational level was important because we know the work that we do at public health is important to the health of our community, and we are part of that community. I would like to note that our health promotion team, our division that we work on, in the past has worked on topics such as ACEs and neuroscience. We are also currently talking about ACEs and PACEs. So we had some context about the impacts of trauma on a person's mind and body, and we took all of the research and the information that we had at that point to our manager and then ultimately our director. And we were asked, like, what would this look like? What how do we make this practical? Um, During that time, some questions started to arise about other divisions and programs that we have here at our local public health department. We house positions in things like veteran services, we have harm reduction, we have emergency management, and even vital records management. Those are birth and death certificates, environmental health specialists who are working in the field every day with the public. Um, and then out of those conversations, we started drafting a policy, an outline. The first task that we had was to decide exactly what we were talking about. What did we want in the policy? What was that going to look like? We had found that were there wasn't really consistent terminology across the resources that we had thus far. We just kept coming up with more terminology. The example shown here is some of the definitions that we had found. As we were gathering the definitions, we started to learn that each one of those sometimes were layers to like another term or another definition, and they were kind of connected in some ways. Even some were defined in the same way but used a different term. And after we kind of worked through that, the second task that we had to figure out was like, what are we actually asking from our organization? Like, what kind of support did we want? Or did we think was going to best support the team and the staff members here at our health department? And what were some of the resources that we already had at our disposal? We, in the policy, we started with a purpose statement. The original statement we had drafted was much longer and pretty specific. We kind of shifted slightly to become a little bit more broad, and we'll go into that why in the next couple of slides. So it now states to contribute towards a trauma-informed workplace at the Kittitas County Public Health Department. The next part of the policy is definitions that look like the examples shown on the slides here. We decided that this definition table is so that everyone can have a basic trauma-informed language and an understanding of how these terms can relate to their own experiences. The policy goes on to explain a little bit further that we foster a workplace that seeks to understand trauma and supports employees, and that we recognize that some positions, like I mentioned before, are at higher risk for mental health impacts, and that this policy should be communicated to all their employees. Then we listed the best practices and evidence-based solutions that we use to create the definition table and support the policy intent. We really wanted to use the research that we wanted to highlight the research that we had come across in order to create this. We also included reference to our HR and then our current EAP program and some of the benefits for our health insurance coverage. There were a few other supports that were specific to our public health department. We are connected with the county, so the county offers some of those supports. However, we have a few that are specific to our department. The rest of the policy kind of explains how we intend to have the guide in addition to the policy. The guide will expand on topics and resources, and we'll get into that in the next couple of slides.
Yeah, so with the policy, the intention is to be clear about what we are asking from the organization. It kind of sets the standard for things that we as a department must do or practice. And then because the policy may be on a 5-year update cycle, it made sense to create a guide that can be updated more frequently, as we discover new research and best practices and kind of continue expanding on this. So in 2021, the National Council for Mental Well-Being reported that 70% of adults in the US have experienced at least one traumatic event in their lifetime. So if you work in a team of 4, 3 of them have experienced trauma. Rebecca and I work in a team of 4, and we think it's pretty safe to assume that all 4 of us have, all experienced a traumatic event in our lifetime. And those effects of trauma don't just go away when you're at work. And then those traumatic experiences that you may have experienced outside of work may increase your risk of experiencing vicarious trauma at work. So, for example, a child fatality review facilitator that has experienced a house fire and is reviewing a case involving fire may be more likely to experience vicarious trauma symptoms. And I think in public health, we tend to be familiar with implementing trauma-informed practices with those that we serve. And we may be less familiar with how a trauma-informed approach can benefit us as employees and the culture of an organization. And what we want to help do with the policy and the guide is to help normalize these symptoms for staff. So in the guide, the introduction page includes key takeaways to help normalize that experiencing trauma is common. It can happen in any profession, and it can change your views about yourself, the world, and the future. We also wanted to highlight that this guide is not a checklist because becoming a trauma-informed organization is not a one-size-fits-all approach. It's a long, ongoing process that anyone in the organization can contribute to. You don't have to be a supervisor or a manager in order to contribute to that culture. And the introduction page also includes the benefits of trauma-informed practices, and these can include like improved employee well-being and mental health, fewer sick days, lower healthcare costs, and an overall greater resiliency and stress tolerance. So after the introduction to like what a trauma-informed organization is, the next section of the guide provides background and education and reference materials. So we expanded on what trauma is, how it can affect individuals, communities, groups, and large amounts of people. And then we also provided examples of each of these situations. And then with vicarious trauma, we expanded on some more education around that, like the types of professional um, or professions and internal programs with greater risk. And we also go into the cognitive triad of traumatic stress, which is which outlines that vicarious trauma can change, how you view yourself, how you view the world, and how you view the future. The next couple of pages include more definitions and examples of how they might show up, like the definition of vicarious trauma and how vicarious trauma may show up for you. We also talk about trauma responses and trauma symptoms, highlighting that trauma responses are normal reactions to abnormal events. Then we provide examples of individual coping strategies. These can include, informal debriefs like Rebecca and I experienced after our first review meeting, hobbies, or professional help. And as part of the background education, we also explain some of the science behind childhood trauma. Both positive and adverse childhood experiences can have a profound impact on lifelong health and well-being. So we provide some information about neuroscience, which is the study of how trauma affects our lives in different ways. And we also go into some background information on PACEs, which are positive and adverse childhood experiences that influence development, well-being, and long-term outcomes in life. So the second section of the guide focuses on evidence-based strategies that people in the organization can use. This section includes specific tips for implementation and resources to learn more if people are interested. So the first strategy is support and belonging. People bring differences into the workplace, like different cultures, backgrounds, lived experiences, or skill sets. And celebrating these differences helps to create a culture of support and belonging in the workplace. Oops. And then the second strategy included in the guide is SAMHSA's 4 Rs of a trauma-informed approach. These include realize, recognize, respond, and resist. Um, so, the organization needs to understand that trauma can affect both individuals and the organization as a whole. Um, Employees need to be able to recognize the signs of trauma and integrate trauma-informed approaches. And then the organization also needs to be seeking to resist re-traumatization. So the third strategy is SAMHSA's 6 guiding principles to a trauma-informed approach. And these include safety, trustworthiness and transparency, peer support, collaboration and mutuality, empowerment, and cultural, historical, and gender issues. And in the guide, we include with the strategy, what these principles mean for the organization, as well as ideas for implementing them and resources to learn more if somebody is interested. And organizations can embed these principles into their culture by using them in their daily practices, procedures, and policies. So, for example, to help staff with peer support, coworkers can schedule intentional debriefing sessions after challenging work experiences, like child fatality reviews. And attending these sessions would always be optional with no requirement to participate because while it may work well for one person, it may not be the right fit for another person. Okay, and then the fourth strategy in the guide is similar to the last one. It also uses SAMHSA's 6 guiding principles. However, it focuses on trauma-informed supervision. So the organization can help foster a culture of trauma-informed supervision by incorporating the elements of SAMHSA's trauma-informed care principles into the supervisor or supervisee dynamic. And what this might look like is that, when there is an employee that typically is high performing, engaging, meeting deadlines, and those behaviors start to change, a trauma-informed supervisor or manager would see this shift in behavior as a signal for more proactive support instead of just saying that that team member is, lazy or disinterested, or even just telling that person to just do their job. And the guide includes trainings, resources, and applicable tips to help supervisors learn the skills to practice this. So the final section includes a summary of just kind of quick tips from each of the 4 evidence-based strategies. So if you're someone that is maybe looking for a refresher or having a hard time reading through the whole document, you can go to this last section and get some an easy overview. And it also highlights tips for preventing, mitigating, and addressing trauma in the workplace. And then we included the existing resources that our employer already has, like the Employee Assistance Program and other county benefits. We wanted this to be a quick place for people to find information. And even though you're getting this information from human resources, that doesn't mean that you're absorbing all of that. And it could be helpful to have a reminder of the support that is in place. So over time, the goal is that the organization has shared language to talk about trauma, awareness that vicarious trauma exists, and that some programs may be at higher risk of experiencing it, and then that the organization prioritizes education and further trainings so that employees are better able to identify symptoms and managers may be better able to recognize them and help with further support.
We would like to note that the policy and the policy guide are not currently completely finalized at this time. We have come across a ton of great resources, and we keep in mind that this is an ever evolving topic area. The one journal article that we shared was in 2021, so there's lots of new research coming out all the time. We have we decided to create like a brain dump document is what we called it, and we titled it Wishes, Hopes, and Dreams. No idea was too big or off the table in this document. We have ideas that are for future development, expansion of the policy and the policy guide, as well as some sustainability ideas. The progress that we've made in the development of both the policy and the guide, we had decided that it would be interesting to see if we created an updated logic model. This time, what we had produced as a long-term outcome was access to mental health resources, as well as the education and the policy and the guide. This was one of the first concerns this time, instead of kind of like the last thing that we came up with or thought about like an afterthought. You're on mute, Cameron.
Thank you. So if you're interested in seeing updates, please scan the QR code or you can click the link in the presentation slides and we'll email out finished products, like finished policy and guide. And the appendix to these slides includes our references, the definitions we've developed for policy and guide, and then also some existing tools, journal articles, videos, and paid trainings that we've used. And I'll just go through so you can see our references, definitions for trauma, vicarious trauma, secondary traumatic stress, burnout, compassion fatigue, and resilience. Then here are the existing tools that we've used to help build the policy and guide. Journal articles. These are some free webinars and videos, and the link to the Tacoma Fire Department documentary is on here. And then these are some paid trainings that are available as well. So thank you for taking the time to watch this presentation, and please reach out to us if you're interested in hearing more.
Thank you, everyone.